We're going to talk about breathing. As usual, I'm going to go over the function of the respiratory system and then a brief anatomy of the respiratory system, and then I'll get into the words parts that are specific to the respiratory system. I think you're all aware that the respiratory system is designed to oxygenate the blood and to get rid of carbon dioxide. So it achieves that by moving air in and out of the lungs, and diffusion takes care of the part of moving oxygen from the lungs into the blood and carbon dioxide from the blood into the lungs. The lungs have a secondary role to play in the control of blood pressure. The blood vessels of the lungs contain an enzyme known as angiotensin converting enzyme, or ACE for short, that converts a hormone called angiotensin 1 into its active form, angiotensin 2. Angiotensin 2, as the name implies, angio meaning vessel and tensin meaning pressure, increases blood pressure. So if blood pressure falls too low, then you get this conversion of angiotensin 1 to angiotensin 2. In order to fight high blood pressure in patients that have hypertension, high blood pressure, they receive drugs that inhibit that enzyme. Those drugs are called ACE inhibitors, ACE inhibitors. And I believe that is going to come up in the terminology that you have to learn for this chapter. So if we look at the upper respiratory system basically goes from the nose down to the trachea. You draw air at rest in through the nostrils into the nasal cavity. These three ridges are bony ridges in the nasal cavity called nasal conchae, also known as turbinates. You'll see that term come up as well. And the job of the turbinates, when that air enters, the turbinates spin the air around so that it comes in contact with the moist mucous membranes and is humidified. It also gets that air spun around up to the very top of the nasal cavity up here, where the olfactory epithelium is. That is where all of the smell sensors are. All the neurons that sense smells are way up at the top here. So moving that air around in the nasal cavity is important. The air that then moves into the nasopharynx, or the space behind the nose, down through the oropharynx, the space behind the oral cavity, into the laryngopharynx, which is the space behind the larynx. Then it's sucked into the larynx, past the vocal folds, and down into the trachea. So I'll point out the vocal folds here, often referred to as vocal cords. They're connected to muscles and cartilage that can vary the tension in those folds, and that creates sound. When you exhale, air passing through those vocal folds creates sound that is then shaped by the oral cavity, the tongue, and the soft palate, and the teeth, and the lips into words. Just a reminder, these pharyngeal tonsils are also called adenoids. The lower respiratory system is everything from the trachea on down into the depths of the lungs. So we see here that the trachea is the main airway, and it drops down into the thoracic cavity, the chest cavity, and bifurcates or splits into two main bronchi, the right and the left bronchi. Those bronchi will then split into secondary bronchi, and those bronchi will branch into tertiary and on down into smaller and smaller airways. The very smallest airways are referred to as bronchioles. Bronchioles. If you remember, that suffix oles makes the root small. So if the root is bronch, this is a small bronchus. You'll also notice that the right lung has three lobes. It has an upper lobe, a middle lobe, and a lower lobe, whereas the left lung has two, an upper lobe and a lower lobe. And it has this little notch in it called the cardiac notch because the heart sits nestled between the two lungs and points off down into the left. So the left lung has a little less capacity than the right lung. When we get down deep into the lungs, the very smallest bronchioles are referred to as terminal bronchioles, and they end in these grape-like clusters called alveolar sacs. And each one of these grapes, if you will, is an alveolus, single alveolus, which comes from the Greek for cavity. And you'll see that each alveolus is connected to the airways. This is where the gas exchange occurs. So if we look over on the right here, in blue is deoxygenated blood coming from the right heart, and it bifurcates into smaller and smaller vessels into capillaries. Blood moves through the capillaries across the surface of the alveoli. They pick up oxygen and dump carbon dioxide. And then they anastomose into venules and into veins and on back to the left heart in the pulmonary veins. So, word parts related to the respiratory system. Adenoido, literally this means looks like a gland, and that refers to those pharyngeal tonsils. So an adenoidectomy is removal of those tonsils, and adenoiditis is an inflammation of those pharyngeal tonsils. We saw tonsillo already. It means any of the tonsils. So a tonsillectomy is removal of them. Tonsillitis would be an inflammation of them. Both naso and rhino mean nose. So a nasogastric tube is a tube that leads from the nose to the stomach for feeding patients that are incapable of eating. A nasendoscope would be a device used to look inside the nasal cavity. Rhinorrhea is a runny nose. Rhinoplasty would be surgical repair of the nose. Septo refers to the wall that separates the nasal cavity into a left and right. So a septectomy would be removal of that septum, or a septoplasty would be surgical repair of that septum. And septum is a context-specific root. It means a wall, but what wall depends on the context of the body part you're talking about. Sino and sinus refers to sinuses. You have hollow spaces inside the frontal bone, the maxilla, and the sphenoid bone that are lined with mucous membranes that can become inflamed or infected. So sinusitis would refer to an inflammation of that mucous membrane inside one or more of sinuses. Sinusotomy refers to an incision into the sinus, oftentimes to relieve pressure or to relieve pus. Laryngo refers to the larynx, or what's sometimes often referred to as the voice box because it contains those vocal folds. A laryngospasm would be a contraction of the larynx. A laryngitis would be an inflammation of the larynx, often affecting those vocal folds and your ability to speak. Pharyngo refers to that passage for air and food that starts behind the nasal cavity and the nasopharynx drops down below that to the oropharynx behind the oral cavity, and then finally the laryngopharynx behind the larynx. Of course, tracheo refers to the trachea, the main airway. So a tracheotomy would be an incision into the trachea. A tracheostomy would be a creation of an opening into the trachea. A person was having difficulty breathing because of something in the upper respiratory tract. You may have to make an opening directly into the trachea to allow them to breathe. Pneumo, pneumato, and pneumono all refer to air or the lungs. A pneumomelanosis is a condition of black lung. Pneumatology, of course, would be the study of the lungs. Pneumonia would be a condition of the lungs. Pulmono refers to the lungs, whereas these three, pneumo, pneumato, and pneumono, can refer to air or lungs. Pulmono only refers to lungs. So a pulmonologist is somebody who studies lungs. Anything having to do with the lungs is pulmonary. Here we see lobo again. We saw this in the nervous system chapter. In this case, it's referring to those lobes of the lung. So in this context, a lobectomy would be removal of a lobe of the lung, and a lobotomy would be an incision into one of the lobes of the lung. Broncho and bronchio both refer to fairly large airways. A bronchoscope is a device used to look down into the bronchi. Bronchiostenosis would be a narrowing of those airways. The suffix "ol" makes the root smaller, so this is a small bronchi, a small airway. So bronchiolitis is an inflammation of those small airways. Bronchiectasis is a widening or dilation of those airways. Ectasis means a widening or a dilation. Alveolitis, it's those small air sacs. Alveolitis means an inflammation of those air sacs. Alveolar refers to anything having to do with those air sacs. I will say also that you have other alveoli in the body. The sockets into which your teeth fit in the jaw are also referred to as alveoli, so it is somewhat context specific. Sterno refers to the main breastbone down the middle of your chest. So sternocostal refers to that sternum as well as the ribs. Sternotomy would be an incision into the sternum, oftentimes used to draw some bone marrow. Costo refers to ribs. So a costectomy would be removal of a rib. Costophrenic, in this case, phrenic is referring to the diaphragm and the ribs. Thoraco, pectoro, and stetho all refer to the chest. In thoraco, the C can sometimes be the K sound and sometimes be an S sound. So for example, this first one is thoracic, where the C takes on the S sound. Pectoralgia, which is pain in the chest. Or pectus excavatum, which is a bowing out of the chest. Or a stethoscope, and in this case it's odd. The scope doesn't mean to look, a device meant to look, it's a device meant to listen to the chest. Pleuro refers to membranes that cover the lungs. So there's an outer pleural membrane that lines the inside of the rib cage and the top of the diaphragm, and an inner pleural membrane that is held tight to the surface of the lungs. Those two membranes are in close contact with each other normally and are never separated under normal conditions. So pleuritis is specifically an inflammation of the membranes that surround the lung. A pleurectomy, of course, would be a removal of those membranes. Phreno, as we saw in the nervous system chapter, comes from the Greek for the seat of emotions, which they felt was in the chest, kind of like we think of our emotions coming from the heart. So phreno really meant near the heart. And in this context, in the context of the respiratory system, phreno refers to the diaphragm, which sits at the very bottom of the thoracic cavity. So a phrenospasm is a hiccup. It's a muscular contraction of the diaphragm. Phenoplegia would be a paralysis of the diaphragm, making breathing extremely difficult because that is the main respiratory muscle that contracts to draw air into the lungs. Oxo refers to oxygen. So hypoxia is a condition of not enough oxygen. Hypoxemia is a condition of not enough oxygen in the blood. Both spiro and pnea refer to breathing. So spirometry is the measurement of breathing, where they measure the volume of air that you can move in and out of the lungs, as well as how fast you can move air in and out of the lungs. Sleep apnea, pnea means breathing, a means not. This is a condition where you stop breathing during your sleep. Capno and carbo both refer to carbon dioxide. So hypercapnia is a condition of too much carbon dioxide. Hypocarbia is a condition of not enough carbon dioxide.